Welcome back. The wildfire smoke we saw across the Northeast this summer was a shocking encounter with Mother Nature. Wildfires in northern Canada, fueled by drought and strong winds, blew smoke and haze across upstate New York cities, including Buffalo, leading to air quality alerts like we'd never seen before. The air was unsafe to breathe for a lot of people, and a lot of people were told to stay inside because of that. In the thick of it, air quality sensors around the state showed some people real-time info about the air quality in their neighborhoods, but the folks at Cornell University also noticed something else, a need to expand that monitoring, which they are doing now. So we're joined now by Corinna Noel, an epidemiologist and assistant professor in Cornell University's Department of Public and Ecosystem Health. Thanks for being here tonight. And I want to start by asking, how did you figure out this expansion was needed and where to put these monitors?
Yeah, thanks, Kelly. So my colleagues and I have been working on related wildfire and health work for some time now. And so, of course, when the wave of smoke hit us earlier in the summer, we naturally went to see what the smoke air quality was in our area and across New York State. And so what we did is we went to the Environmental Protection Agencies, or EPA's, wildfire and smoke map. And what we noticed when looking at broader New York State was that almost 50% of the counties, most of them rural, did not have access or did not have any data from a high quality air quality sensor. And we also were receiving reports from public health partners around the state saying that they too did not have access to any localized data. And so with that, we teamed up with Cornell Cooperative Extension, who helped us reach out to these counties that we had identified that did not have any of these monitoring sensors. And what we did is we were able to provide and help these counties install some of these air quality sensors so that their local jurisdictions would have access to this higher quality air quality monitoring data.
So more than 20 counties did not have sensors. Do you know yet where you're putting them in or where you've put them in Western New York? And then explain how they work. All right, we just want to check to see if you can hear us. Can you hear us now, Corinna?
We can hear you.
Awesome.
Yes.
All right, I'm going to ask the question again so that you can hear the question. How did you decide where in Western New York to put the monitors and the sensors, and just explain a little bit how they work?
Yeah, that's a great question. So when we actually provided sensors to all over New York State, but when we look at Western New York in particular, we see that actually 10 out of the 28 counties that were provided sensors were in Western New York. Some of those include Allegheny County as well as Genesee County. And so how these sensors work are by detecting levels of really small particulate matter, which is a main component of wildfire smoke. And so when partners...
Oh, go ahead.
When partners install these sensors, they actually are able to upload their data and contribute to the EPA's wildfire and smoke map, thereby providing more localized and timely access to data.
Well, we appreciate your work. We've been speaking with Corinna Noel of Cornell University's Department of Public and Ecosystem Health. Corinna, thank you for joining us tonight.
Thank you.